Hello and welcome in this week's health show. We're in the Blood Institute in Paris. People come here to donate blood, but not only, they also donate bone marrow. In this show we'll see what it is and how it works. We'll also head off to the United States where Barack Obama is pushing forward his healthcare reform. Some say it will cost too much. We'll also be talking about money and healthcare in France. The government is looking for ways to plug a gaping hole in its health deficit. But first, the news in brief. The morning after pill soon available in France and Europe. This emergency contraception is 95% effective up to 5 days after sexual intercourse. There are 2% less doctors in France. Despite government incentives, they're leaving rural areas. German and Algerian doctors are called in replacement. Each year, thousands of adults and children suffering from leukemia and other forms of cancer are waiting for bone marrow transplant. But not everyone can give, and on the receiving end, there's a chance in a million that the person will be compatible. France has launched a major campaign to encourage people to come forward and donate. Now, let's see the importance of this donation and how it works. There's a chance in 1 million that this woman's bone marrow will save someone's life, but she's still ready to take the tests. She might be compatible with a patient on a waiting list. The first step is an interview with a doctor. Medical staff need to know the donor's age and recent travel information, for example, but they also clarify the procedure and always support the donor.
You have to know that you're free and that at any time you can decide that you don't want to donate anymore. We only take bone marrow, we don't touch the spinal cord. That's something different. People take absolutely no risk when they donate bone marrow. Even if donating bone marrow is a long-term engagement, it's really worth it when you know that you might have saved someone's life.
Bone marrow is the spongy tissue in some bones like the hip and the thigh. It contains stem cells which can help cure leukemia and other cancers. One way to collect it is with a needle under anesthesia. Often, it's people who know someone who need a transplant who decide to do it.
It is wonderful to think that you have kept someone alive.
There's a 25% chance to find someone compatible within the family. This 32-year-old Lebanese woman received bone marrow from her younger sister when she was 6. It's something that she won't forget, but she hasn't thought about donating.
It's obviously an important event in my life, but I still haven't thought it over enough to do the same for somebody else. I haven't thought about donating bone marrow in Lebanon, for example. I saw children there who needed it and didn't survive.
Often, relatives don't live nearby, as it is the case for diasporas, and in some countries, there is no national database of people willing to donate bone marrow. An association has been set up in Paris to encourage people from the Middle East to donate. It also wants to start listing people in Lebanon and neighboring countries.
The more these communities are informed about the importance of donating bone marrow, the higher the chances for these people in France and abroad to find someone compatible.
In Africa too, few people are informed and there aren't any lists. Increasing the number of people aware of the importance of donating will increase the chances of someone with cancer to stay alive. In the United States, it's not giving blood and donating bone marrow that's preoccupying the Obama administration, but it is a healthcare issue. The president is embattled in his healthcare reform. Critics say it'll cost too much. Some 46 million Americans are without health coverage. Let's see exactly what Obama wants to change.
Joe Chaza is one of the 46 million Americans who don't have health insurance. Joe's business went bankrupt and he can no longer afford to pay his medical bills. Despite suffering from chest pains, Joe refuses to go to hospital.
The last thing I need is to go to an ER. And I'm going to end up walking out of here with a bill $10,000, $20,000. I don't have $10,000, $20,000. And I can't picture having a $10,000, $20,000 medical bill that I pay off a little bit every month for the rest of my life.
According to President Obama, a reform is necessary to provide greater access to healthcare for people like Joe, people who are not poor enough to be covered by government schemes like Medicaid, and people who are not covered by their employers. The reform could establish a public health insurance plan run by the government.
It will provide more security and stability to those who have health insurance. It will provide insurance for those who don't. And it will slow the growth of healthcare costs for our families, our businesses, and our government.
Yet many have protested against the plan. Private insurers fear more competition, taxpayers object to a tax rise, and the opposition says the US deficit will increase. President Obama says the reform will cost around $900 billion over 10 years, yet the money will not come from taxpayers, he says, but mostly from cutting out billions of dollars in fraud and waste. Obama hopes to get a reform bill passed this year, but as congressmen don't seem to agree on the formalities, the president is likely to modify his plan.
And people are hurting.
Just after the United States, France is the second country that spends the most on health, but it's the government that pays the bills. And the government could ask the French to chip in, a move strongly criticized since keeping health fees low is a privilege.
The hole in France's health budget is expected to reach €20 billion this year, a headache for the minister in charge. She says the situation's been exacerbated by tough economic conditions.
For the first time, the deficit is not down to too much spending. That's been brought under control. The difficulty is that tax receipts are down because of the financial crisis.
Another problem, old age pensions. The deficit there has been growing since 2005. Today it stands at €7.7 billion. To limit the overall health shortfall, the government wants to save €2 billion, hence a hike in the fees patients pay hospitals for each day of their stay. Hospitalisation costs are set to rise from €16 to €20, the 15th price hike since they were introduced in 1983. At the moment, the system brings in €1 billion per year. With the planned rise, the government looks set to raise an extra €250 million, just 15% of its savings target. That's why other options are under study, including slashing the portion of bills picked up by Social Security for non-prescription drugs like paracetamol, and cutting cash paid to doctors for certain services. Further details of how to plug the hole in the budget are due to be hammered out in October.
It's in hospitals like this one that more and more TV shows are set, like Dr. House, for example. He comes up with extraordinary medical achievements, and patients, viewers, tend to forget that it's only fiction. We'll see the consequences next in our Strange But True. TV shows were created first for people to disconnect from their everyday life. But more and more there's a new trend. People tend to think that shows are everyday life. And when they watch programs which are set in hospitals with doctors who manage to cure the most severe illnesses, then they expect real doctors to do as well, putting pressure on medical staff. But the shows are fiction, and doctors in real life are under pressure to come up with the same results. Patients tend more and more to think there's a Dr. House in every hospital, and they expect a lot from medical performances. But real life is far from fiction, something patients tend to forget more and more. That's it for this week's health program. See you next week with more information.